Just wait a couple of minutes for people to come back. Yeah. Just fixing their own personal wicked healthcare problem. How are energy levels? Are we getting a bit tired now? Really? I'm exhausted on the intellectual. Okay, I'll get started then. So this is the final session, and I was a late addition to the agenda, so I haven't had an awful amount of time to pull this together. So I'm basically cribbing from a presentation that I've used before, added a few bits. There's quite a lot here, but I've told that you're so super intelligent that it would be best to have quite a lot in and rip through it quite quickly rather than have a subset, because healthcare is such a massive topic in and of its own right. So I'm going to cover sense making. We heard a lot about sense making, and sense making is the theme that I'm going to be using, because health is a really wicked problem, and it's not something that any individual organization can solve by itself. So it's almost taking it up to a meta level. It's one of these societal problems that requires coordinated action by multiple actors. So it's really looking at how we might think about this challenge in healthcare. So I'll talk a little bit about the nature of the problem and Industry 4.0. There's a whole bunch of new capabilities coming along that help us to rethink what we do in healthcare. I'll tell you about a project that was commissioned by the Royal Free Charity, which is a research project, which is essentially the body of work I'm going to present to you now. So I was very fortunate to find myself in the right place at the right time for that. I'll talk also a little bit about the long-term trends that are going to change the healthcare landscape. So it's not just about changing what we've got, but also looking at what's coming and start to reimagine what becomes possible. And then I'll introduce some of the ideas around, okay, given all of that, how might healthcare be different in the future? What might arise out of this future that we can start to see some shape of what a 21st century technology-powered healthcare might look like? And what might be the journey of transformation with all these actors working in their little silos to start to think about coming together as a system rather than as a set of individual actors. So let's just spend a little bit of time looking at the nature of the problem. So all of us are well aware that NHS is permanently in crisis. In fact, every healthcare system in the world is in crisis. There are multiple reasons, three big ones: rising chronic disease, obesity, diabetes, all the rest of it; aging populations. So one good thing is we're living longer, but we're living longer with more disease. So that becomes a growing burden. And there are new innovations popping up all the time that come into the kit bag of what healthcare can prescribe to you. So to do nothing, just keep the system afloat. The costs seem to be rising 4 to 5% a year just because of these reasons. And already healthcare in the UK is 10% of the entire GDP of the country is spent on it. So you can see compoundly 5% per year. It won't take long before 120, 130 billion now starts to edge up to sort of 200 plus billion by 2030. And increasingly, that's 20% of the government's expenditure is on health, and it could be 30%. So everywhere around the world, this is a systemic crisis. We're on a kind of burning platform of what the hell do we do with healthcare. And interesting enough, 70% of those costs are due to preventable conditions. There's a clue in there about where some of the answers might be. The NHS National Health Service is probably more correctly termed the National Sickness Service, because it doesn't actually do a lot with health. It waits until you get sick and then comes in. So what causes all this ill health and early mortality? Well, there's been various research done on it. It's surprisingly genetics is only about 15%. Your predisposition through your genes to get sick is a small percent. The environment that we inhabit, said healthcare itself, how good the healthcare is, will play a huge role. But by far and away, the greatest factor that drives healthcare outcomes is social economic. And that's interesting because that's not something healthcare systems traditionally focus on, yet it's the biggest driver of healthcare. So if we're to get a grip on this whole healthcare challenge, we need to get better, much better at understanding the causes of ill health and how we address upstream some of those issues, rather than, or as well as thinking about how we solve the issue of how to treat people better who are sick. And this needs to become a real sort of dynamic system of better understanding the nature of the problems, being able to get some grip on it, and undergo the transformations within our institutional structures to be able to address that so that we can get a dynamic learning system that can improve. So the healthcare system is massive. So if we're thinking about how we create value through design, I've introduced kind of 4 modes really, which is at its simplest, design 1, objects and interactions. How do we design those to be to create the most value for health outcomes? But those are simply interactions and encounters. We need to think also about how do we support people to maintain and maximize their health? How do we provide holistic health? And that requires a lot more understanding of all the problem space in a much more detail. There's more actors involved, more pieces that need to be understood to assemble a solution that can do that better. But managing holistic health then needs to sit, it's almost like Russian dolls, inside an ecosystem of actors that can support and deliver this. So much more in the way of sense making needs to be done to understand how those different actors, what their needs are, to be able to assemble a solution that can meet the needs of those as well as provide the better healthcare. And if you roll that up into design level 4, a healthy society is essentially what we want, and some of that is outside the purview of health system actors. It's to do with government policy, it's to do with culture, it's to do with what kind of responsibility we want to take for our own health, it's to do with the international environment in which a lot of these systems sit. So there are multiple layers, and each one as you go up requires much more understanding of the nature of the problem. It needs much more sense making to be able to understand where to do the change making. And sense making is not done at this scale for this kind of wicked problem in this holistic way, because each of the actors have their own local interests and therefore see only a partial piece of this. So interesting, going back in history, if we go back sort of thousands of years, or even hundreds of years, health, before we understood the science of the body, was much more understood as something holistic. It was something about seeing yourself and the way you live in nature as well, something about finding harmony. It was about holism, and it was about harmony. And most of the practices that we now seem to go back to, like yoga and Buddhist principles, almost like rediscovering this holistic notion that our health is something about the whole in harmony. But as we've progressed through the scientific revolution, and we've come to understand that there are causal factors and there are things that we can look to discover and through reductionism break down into smaller and smaller parts, what we've done is disassembled our health into lots of specialisms and subspecialisms and subspecialisms. So what we've done is essentially deconstructed and fragmented the body. Now we're doing it with the mind, with neuroscience. Our mind now is apparently neurons and neurotransmitters, and this is what we are, which is both an act of fragmentation of understanding of how we work as a whole, but it's also a quite distinctly alienating kind of experience that who are we as a human? Are we just meat and molecules that has some strange properties, or is there something important about being a human being, about having human life, about having purpose and meaning in the world? Because that can't be found in these fractured pieces. So we've got all this exploding knowledge as we reduce and understand all the bits. And the challenge for us is, great, how do we synthesize all that knowledge and bring it together? So I wake up in the morning and I know what the hell to do with all this knowledge. Or a doctor or a medical professional can take this knowledge, synthesize it, and make it useful in the world. So the challenge for us now is really about how do we synthesize all of this exploding knowledge to make it practical and useful to enable individual and societal flourishing, a big challenge. This has become and going to become even more of a challenge as we stand at the dawn of the greatest breakthroughs in science and medicine in human history, and it is accelerating. We heard a little bit about swallowing pills and nanobots. There's a whole lot more going on across a whole lot of spectrum, so it's only going to get more complicated. So this is a systemic challenge, like epistemological challenge of how do we take this exploding knowledge and bring it together to make it useful in the world. And how can we make sure that we synthesize this exponential knowledge and power in service of what it is to be human? Because there is a crisis of meaning in our society at the moment. And a lot of what constitutes health is not just our physicality, it's the way we live and how we feel. And if there is an opportunity to curate better experiences to enable us to live better, to live well, to flourish as individual society, what is it to be human? What is it to live well? Do we know the answer to that question so that we can start to assemble the technology and surface of that? Because if we don't, there's much more risk that far more dystopian surveillance models are going to arise that could lead to worse outcomes. So the question that really was interesting in doing this, what is health? Do we even know what it is? Coming back to definitions. If we're going to need to put a better and more integrated healthcare system together, or model of health, what is health? So the World Health Organization had a crack at this, and they say it's a state of physical, mental, and social well-being, not merely the absence of disease and infirmity. So it's interesting there. It's not just about I'm sick or I'm not sick. It's actually the glass half full. It's about living well, living in a way that one could say was flourishing. How the hell do we think about designing something for that? So I told you about the fortuitousness of myself getting involved in a project. The Royal Free Charity that sits alongside the trust were interested in commissioning some work because they understood that the healthcare system that they're associated with, the Royal Free itself, sits in north central London, which is one of these regions that have been set up by the NHS. And they were addressing this kind of question, which is hospitals are being asked to work in a collaborative fashion with primary care, social care, and public health to come together, recognizing they're serving the same population. How do we get more joined up, unified care rather than having all these individual silos? But at the same time, there's massive medical breakthroughs coming through. There's a whole bunch of technologies and artificial intelligence. So working inside the healthcare system is like, how the hell do we think about that journey of change? Where do we start? Where do we go? So the question that they asked was, can you do a piece of work that looks at all these changes and roll them forward and imagine what it could look like in the future if all of these changes are landed at scale? What might a vision of beyond the fog look like that enables us to think about strategy development, not as incrementally inching forward in a massively confusing world with all these new technologies, but what might a long-term future look like so we can think about strategy as getting to there rather than where the hell do we go from now? And in getting to there, we can see how other actors can work with us, and it becomes a collaborative exercise. So it was a piece of work, a report, which you're more than welcome to have, it's free, which really sets out what that might look like. And so just delving quickly into it, there are 6 mega trends we looked at. One is, what is the nature of society likely to look like, and what's the burden of disease, etc., in the next 10 to 15 years? Systems biology, understanding the body as a complex adaptive system rather than just looking as a bunch of diseases. Personalized medicine, which some of you might have heard about, which is taking one-size-fits-all medicine and personalizing it and customizing it to your particular genome and your particular needs. The whole medtech innovation, which is all the sensors that are starting to appear to measure all sorts of new things that we've never had before. The massive amount of data that will pour out of that. So what can machine learning and AI give us in terms of making sense of that? And then finally, a really important thing, which is the psychology of health. What is it? How do people relate to their own health, to their own selves? What is their relationship with food and exercise? What is the psychology of which and people think about themselves and their health. Because if we have all this capability, but we can't connect in a meaningful way to how people want to take more control of their lives, then we'll miss out. So what would health look like in the future? What would this mean for the future of this healthcare? So if we could map it all out, and this is kind of a lot of things going on here, we essentially looked at the factors that influence health really go from the human body right the way down into the genome. And there's huge amounts of understanding being made about what is the genetic sequencing, what do these genes do. There's work being done on how to edit some of those to actually halt disease. Genes speak through the language of proteins and intercellular networks that then evolve into organ networks that create the whole body. So the body is a complex adaptive system. And there's some really interesting insight as to what's going on in there that's going to be revealed as new insights to how we work. There's us, ourselves, our body, our behaviors, our sense of ourselves, of what we eat and drink, etc., of the societal environment that we sit in, and the environment. So let's just quickly dip through those. So there's fascinating insights being made into how disease originates. At the moment, we go to the doctor when we have symptoms. Something's gone sufficiently wrong that you feel there's a lump, there's a bump, there's something not right, I'll go to the doctor. Now it's being suddenly understood that the way that disease propagates through these networks is such that there are biomarkers that indicate the first indications that something is starting to go wrong before you even know it. So a future healthcare system can start, rather than waiting till people present into the healthcare system to get checked over and to be told they have stage 2 cancer or whatever it is, to a system that potentially starts to pick up at the earliest signs that there's something starting to go wrong. And there's an opportunity there to do corrective action before you even get the disease. And in fact, as they unpack diseases like breast cancer and diabetes, what they're finding is that there are a cluster of causal pathways that lead to this thing called diabetes. But they're not all the same things that go wrong. There's a multiple pathways that cascade of pathological things that end up in disease. So each disease is a cluster of rare diseases. So finding those early on, detecting them and being able to have an effect is really hacking disease in a fundamentally different way. Being able to understand better how people live, how they think about their health, the decisions they make, the exercise, the drink, there's a lot big going on there. There's great understandings coming through in terms of the social context that we live in, the degree to which poverty, lack of education, poor relationships, loneliness are all factors that influence and provide the context which these behaviors then occur, which then have knock-on effects to your own healthcare. And finally, the environmental system, the place that we live, the access to resources, the level of pollution, whether it's dangerous to go outside or not. These then set the broader context for this social life to play out, which then affects your behaviors and affects your health. So a lot going on there. What's interesting in this 10 to 15 year time frame is that they're going to be sensors appearing, and they're already coming through now, sensors in the body, sensors on the body, data or even smart home sensors about the environment and the way that we live, and sensors in the environment writ large. If we were to take a broader look and say health is a factor of all of those things, data is going to be pouring out of that entire spectrum and landscape. If we have the imagination to see that, collect it and understand it, we have for the first time the opportunity to see what the hell's going on across that entire spectrum. To see what's going on in terms of ways that it could support how we support individuals to understand the impacts of the way that they're living on their own health, and to have that in real time. And also to zooming back to allow healthcare systems, local authorities, institutions to see the choices we make and how we design the world that we live have a linked impact to health outcomes. If we can start to join the dots together, we can have evidence-informed policy rather than ideologically driven policy. There's a big claim there, which I'm sure. So how do we make sense of all that data? What we're seeing is really a data ecology, an information ecology that could be massively powerful and interesting. It's going to have to involve the artificial intelligence. So I was speaking to you earlier. We've spent quite a bit of time now with Google Mind, DeepMind, and others. And one of the, if we swift or change now to think about change making, essentially we have a model at the moment which is quite archaic. You go into the doctor and they will have an electronic health record, if they're hopefully not a paper record, an electronic one. And we'll have a record of who came, what's your name, what did you present with, what diagnosis did we give you, what treatment did we give you, what happened when you came back later. It's kind of a system of record, if you like. If you look at any other industry where it's massively data rich, all of them are moving to digital twins. The idea here is, why can't we start thinking about, effectively, we'll call it a digital double, a simulated model of you, your goals, what's important to you, where you live, your behaviors, the biochemistry, the physiological status, which will be receiving data probably in real time from multiple places, that provides a simulated model of your health, so that a healthcare professional can kind of see what story led to this and be able to do simulations, say, what if we were to change this, what might happen? Simulation would be able to do that. So much as meteorology simulates the weather and makes forecasts, a future healthcare record, if you like, shifts from being a flat record to something more akin to a simulation. So how might we think about now situating that inside a new vision for healthcare? Well, if we've got sensors collecting data to provide a much more simulation, that will provide much more holistic information fed into decision support to allow whoever's involved in supporting you in your health, whether it be social care or clinical care, a full spectrum 360-degree view of you. So rather than having to go in and rely on some verbal transmission of what it is that's wrong with me, all the information will be there. But that's not all of the picture, although that's a very fascinating picture, because even those with long-term conditions today, as Kaiser Permanente, one of the big US companies, done some interesting research, even those people with multiple long-term conditions spend less than 0.01% of their time in the presence of a healthcare professional, and over 99.99% of their time by themselves. So health happens when you're in your own life, not what happens in the clinic. So how can this information be made available back to the individual to give them information about how to make decisions, how to live a healthiest possible life with information contextualized to their real life situation? Well, the virtual assistant technology, which we see in the first versions of in terms of Alexa and Siri and Google, etc., essentially provide an opportunity to start thinking about how do we source out of that what is essentially an avatar, a digital health coach, as we call it, that can start to provide contextualized advice that's particular to that individual based on what's going on in their body and what they are doing, that helps them in various aspects of their health. And that could be providing information and knowledge, it could be around helping them with jobs and money and all the rest of it, but it could also provide a number of conversations around the important topics related to health. So it's all the wellness stuff about keeping well and healthy, emotional health, being able to spot risks as soon as possible to get the right support before you get sick. If you do get sick, more holistic support for that. And as people get loss of function through being old or through injury or disease, how to help people to sustain individual living as long as possible. So really, if we take this to its logical conclusion, and here's the provocation we've been making to the entire healthcare system, we start to see data pouring out of patients around or people out of all these domains, which makes possible the potential for a digital health coach to be a new actor in a future healthcare system that provides personalized support to people around all of these elements, which can either be lean back, I don't want to hear from it, I only want to know if there's something wrong, or it could be lean forward, which is play a more active role in helping me with some of the things I'm struggling with, supported by a data system that drives a much more integrated healthcare that's focused not just on sickness, but health coaching, maybe even life coaching with a clinical element to it. So how do we support people to live well and possibly with disease rather than just clinical treatments, which is today's model? And if we have an information ecosystem that facilitates that, the dark blue is the dark colours are sort of more UK public healthcare system. How can that information ecosystem drive other industries who hold other pieces of the jigsaw? How can this help identify the targets for next generation pharma? How can this provide insights to how we can harness and locate the right people to bring in to trial new treatments? And do that as quickly and as cheaply as possible. How do we start bringing information in that can help support and identify where are the hotspots that local community groups can target their resources more effectively in the communities that they serve? How can this drive government policy to see where would be investment could yield the best health outcomes? So essentially, real-time data turns the nature of knowledge in healthcare on its head. Rather than relying purely on structured research that provides knowledge into official training that goes to healthcare professionals that may or may not have received it, but then go into practice. And bear in mind, there's 1 million papers published each year on health-related issues. So there's no healthcare person in the world that could assimilate the new knowledge that's coming from research. Plus, if you take the UK, 60 million sources of real-time data coming in from how people are living, the actions that they take, the health outcomes, what's going on in their bodies. It becomes a living, learning ecosystem that can be incredibly powerful means of improving individual and population health. Now, why would be this a good thing to do? How might this solve the problem I mentioned at the beginning? So, if we get better at prevention, like helping people stay well, people get diseases, will get ill less often. If we can have another bite at the prevention cherry, which is spotting sickness and disease before it becomes symptomatic, there's another opportunity to reduce healthcare costs. If we can provide more effective management of long-term conditions and support people more effectively to live in old age, there's an opportunity to take the amount of time that you live well and be able to bend that curve down, both for individuals and if you take a step back at society writ large. And there's an opportunity there for start to address this sort of escalating costs where we wait on the sickness side of the curve for an ever-aging population with greater disease. This bends the curve and starts to potentially bring healthcare back into control. So these are big pictures, big framing, a vision of what new technologies and capabilities are coming along, and if we were to put them in service of individual and societal flourishing, what might that look like? It's a hypothesis, it's a provocation, and it's a provocation to politicians, healthcare leaders, and other actors in the healthcare system to say, we can either struggle along and start incrementally trying to take these new bits of technology and bolt them onto our old system or old silos, hoping some magical 21st century healthcare system will arise out of that. Or we need to start thinking about what kind of future is made possible by the emerging technology. Have a sense of what that is, debate it, discuss it, and what does that call upon us all to do? Because then we can start to build a plan, a route together to start to make that possible. And in doing so, identify not tactical collaboration, but truly strategic collaborations between private, public, and different entities that will be required, such that the pieces of the jigsaw have a picture that they know that they're building and how they might do that. So these are kind of some of the questions that arise out of that need debating. This isn't likely to happen without some barriers in the way, and some of these barriers at the moment are reasons to pull back. People say, "Oh, no, privacy, that's going to be too difficult. Let's shy away from that." No, these are innovation challenges that we need to set to understand how we transcend them, because lying the other side of that is a way better place if we can use innovation to get over that. So these are some of the big questions. Now, people have gone, Andy, that's like too much. We are where we are. You've just blown my mind. How the hell might we get there? So this was a kind of high-level straw man framework to think about how might you structure a journey towards that. So at the bottom we have largely passive patients who deal with this massively siloed system, and we know it's going out of control. So it's not very good. There is some activity going on at the moment within healthcare to try and get local actors to work together. So how is it possible that all these different actors can start to share their records? So wherever you go in, you see the same record, and there's much more collaboration between still different silos, but there's more degree of collaboration. And that, at the moment, is the NHS long-term plan, minus the prevention stuff, because they haven't really thought that one through yet. So this is a sort of half ambition of our current healthcare system thinking, but we're saying, nah, that's just the first stage towards being able to think about the use of new medicines and technologies to bring greater understanding of real-time data that would empower a whole new way of sharing data, providing much more collaborative healthcare that would lead eventually to that kind of vision that we talk about. So there's a kind of high-level route map to start to assemble this. But if we understand that's where we're going, we can make strategic decisions from here that facilitate a pathway towards that rather than boxing ourselves out. So what happens next? Getting to the end of my time. Yeah. So we've created a cross-sector steering group. So we've got people like the head of healthcare for IBM, government chief science officer of the Department of International Trade, the CIO of NHS England. Some nice senior people who are all in agreement that all our existing siloed plans do not speak to this longer term future. And if we want a 21st century healthcare system powered by technology that is truly person-centered, but is supporting flourishing and prevention as well as sickness, we need some new thinking. So it's great to have them there. We're exploring something with the Royal Society of Medicine. Spinning up at the moment a not-for-profit Vision for Health. If any of you here are interested, love to work with you either through financing or if there's an academic partner, great. And we've started the process of provoking politicians, healthcare leaders. So we've done presentations at the Royal Society of Medicine. We're invited to the Labour and Conservative Party conferences to talk about it, although that was a bit of a crazy experience. And that's it. I hope you found that interesting. You were going to ask something. Oh, thank you. Yeah. Yes. Yeah, I absolutely agree. And what's really interesting, I don't know if any of you have been following the work of Mariana Mazzucato at UCL. So she's been doing some interesting provocation to the UK government and internationally to say some of these problems, like health, don't lend themselves to a simple solution from the private sector. There is huge amounts of illness and sickness and problems in deprived communities where there just isn't a business model. And the public sector doesn't have the capability and resources to get a grip on it either. So we can both ping pong between the two, none of which can do it. Or we can start to think about what she's calling mission-based, which is almost like this, which is to say, we need the government to step up to say, let's do some deep sense making about the nature of the problem, define it, and then create policy and make funding available to make it possible for the private sector and the public sector to collaborate and co-create solutions that finally get a grip on these kind of problems. But it needs big thinking, it needs political ambition, and it needs ambition from the private sector to want to come and be part of something that's truly transformational. Yes, which is... So the industrial strategy, which has a life sciences element to it, is in part trying to get a grip on this. My critique of it at the moment is just fostering lots of little innovations, and it hasn't got its head around this kind of thinking. But there's, as I said, there's a lot of interest in what we've done here. People are scratching their heads going, there's something in here. And when you zoom out a little bit, the worldwide market for healthcare is currently, according to PwC, $7.7 trillion. Every healthcare system in the world is struggling with this problem. NHS is unique in having a national public healthcare system, and essentially a platform. We were talking about platforms earlier. If we could get our shit together, we've got here an asset that not only could deliver better healthcare for individuals, but could lead the world in how to deliver this kind of healthcare at scale. There's a massive opportunity to both support companies to be part of that, be successful in the world, or even export that know-how to other healthcare systems. Layer on top of that the impact of poor health on productivity writ large. So 70% of the people at work are firing off 2 or 3 cylinders rather than 4. The idea of yeah. Yeah. Yeah.
Guys, I'm so sorry, I have to stop. This is clearly a really big subject.
Yes,
We do have to move on, otherwise we'll be here all evening. So thank you so much, Andy.
Yeah, we're going to